I am obviously stopping my share, turning it over to Dr. Kripke, and thank you all for coming.
Thank you so much for that nice introduction. I'm going to share my screen now with you. All right. From the beginning, there we go. Does that look good? All right. Let's talk about navigating pediatric to adult healthcare transitions. I'm a family physician, so I always think that if we all had family physicians who take care of people from birth to death, we'd never have to make a transition. But there are life changes that happen when people become adults that we need to attend to. So the first thing I want to talk about is transition is a process. It's not an event. So when we talk about transition, we want to make sure that we start really early, even starting as young children, learning how to make choices, learning how to describe body parts, learning if we have disabilities about our disability. We need to do that starting very young and learn how to set boundaries with people around our bodies. Those are all skills that we'll need in order to have a successful transition to adulthood. So many people with disabilities who have childhood disabilities will continue to need support as adults. That doesn't mean they're childlike. What it means to be an adult who needs support and be self-directed and be someone who can direct their own services is to be able to set those boundaries, to ask for help when you need it, and to describe the kind of help that you want, and to know when you need help. Those are all parts of being an adult who has a disability or being an adult in general. It's also a skill to learn how to step back from a parent role while still continuing to provide support. So many of our children, as they get to be adults, still need our help. And yet that relationship has to change and evolve to let our children, and I'm the parent of a child with a disability too, to take control and make decisions about their own health care and their own lives. Learning how to set boundaries is a safety issue. When we teach kids that they should listen to authority figures, that they should let people touch them, and many people with disabilities who need personal assistance may have caregivers touching them, people they don't know touching them to help them with personal support, but they need to be able to say what kind of touch and when it's appropriate and when it's not appropriate, and decide who can touch them and when they can touch them. And we need to start early by not telling kids that they that they can't set those boundaries, that they have to give someone a hug or allow someone to give them a pat on the head or touch them if that doesn't feel comfortable to them. So on this slide, you'll see a resource. What's Next? A self-advocate's guided tour through transition for parents and other supporters. It's available in Spanish, Chinese, and English, and it has a lot of information about how to make that transition, how to back out of your parent role and allow your kid to step up. Communication is the foundation of patient care. 80% of making a medical diagnosis is based on the history you get from the patient. And so it's critically important for people to be able to direct their own lives and their own health care, and for people's health to have a way to communicate. Everybody communicates. We need to find a way. If your child doesn't have a way to express themselves. If they don't express themselves through speech, and they don't have augmentative and alternative communication methods that that allow them to express when they're being mistreated, that allow them to say what's wrong in their body or what doesn't feel good or what does feel good, or to make choices, then that needs to be a priority. The Office of Developmental Primary Care developed a toolkit, and you have the link to it there. It's also available in Chinese, English, and Spanish, and it will help you to know what kind, if you need that kind of support, how to access a good assessment, how to know if the assessment that you're getting is a good assessment, and then how to get help with communication funded through various programs, your health insurance, schools, the regional center. There's many different sources of help to fund communication support. But if you aren't, if you're supporting somebody who has a communication disability and has a speech disability, please work on this now, because that's a critically important skill for transition. Next, when we talk to adults about transition, what they often say is that because their parents always came with them to appointments, they spoke for them, they talked to the doctors, they actually don't know a lot about their own conditions. And it's critically important that we teach children about their disabilities. Sometimes people have very complicated medical histories. They have had a lot of surgeries or hospitalizations, or they have complicated medical regimens, like lots of different treatments or lots of different medicines. It's important that you teach your kid what all those pills are for, when to take them, what the side effects might be, what their conditions are called. And if you don't know, then have your doctor and your doctor's nurses help teach both of you together. Only your child, only people with disabilities, only you know about your own internal sensations like pain and weakness. And so it's not okay for a doctor to ask your parent or to ask a supporter what's going on with you. We need to be able to ask you. And so when people are kids, usually their parents speak for them, but learning how to describe what's going on inside your body, learning the words to use, learning how to talk to a doctor is a skill, and it needs to be practiced when you're still a kid. So if your kid is getting to be a teenager, then when you first go in the doctor's office, you can have them say what's wrong, why are they there today, have them talk to their doctor before you get in there, and maybe you'll add things, but at least let them start and practice that skill of talking to their doctor. It's also important to organize your records, your medical records. Medical records are found in a lot of different places. Your doctor has some of your medical records, but a lot of people with disabilities have gone to a lot of different hospitals. They've seen a lot of specialists. They may have gotten assessments through the school or California Children's Services. So their records are all over the place, and there's good information all over the place. It's important to get all those records together and make sure your primary care doctor has a complete set of records and that you have a complete set of records, because once you graduate from school or graduate from these programs, it can be very hard to get those records, and they can be very important moving forward. You don't want to be 30 years old and say, well, what surgery did you have when you were a kid? And nobody can answer that question. Or we know you took this medicine before, but we don't know what happened when you took it, and nobody can answer that question. So, collect all of your records and make sure that you have a copy of them, that your child has a copy of them, that if your regional center client, your regional center case coordinator has a copy of them, so that years in the future, when that information may be very important, and you don't want to lose it or have it be inaccessible. In addition to teaching people about their health conditions, people need general health education, including sexual health education. And a lot of people with disabilities who are in special education get skipped over for health education. They don't get information about their bodies, about their sexuality, about changes like puberty, and we need to teach that to our kids. And here we have a resource for you to help start that conversation about sexuality, so that people can have general health education. They're not going to be able to report on what's going on with their body if they don't have the words for their body parts, including their sexual body parts. It's very important to talk to people about sexual health and sexual feelings, as well as general health care. Healthcare decision making. So everybody needs support to make decisions. When I see patients who don't have disabilities, they frequently bring family members with them to appointments, or bring friends or other people with them to appointments to help them have another person listen to what the doctor's saying and to make them feel supported in the doctor's office. So people without disabilities do that, and people with disabilities also need support to make decisions. And sometimes people feel that if they have a child with an intellectual disability, or who has a speech or communication disability, and they know that their child is going to continue to need support and help with going to the doctor's office, they can feel like people can suggest that they go to a judge and get conservatorship. But we are moving away, the disability field and the medical field and the law is moving away from conservatorship and towards supported decision making, which is what we all do, which is to bring trusted family members and supporters with us to help us make decisions. And so supported decision making empowers people with disabilities to name a trusted supporter to be with them when they go to the doctor, and to help them make decisions, help them understand what is going on, help them communicate their choices. Other things you can do with the health plan, if your child needs assistance with calling health plans, making appointments, dealing with their medical bills, that kind of thing, you can fill out a piece of paper called an authorized representative that allows someone else, a parent or a friend or someone else, to help you with those things. You can also get a power of attorney, which is a legal form that says I'd like this person to help me help me by making decisions for me. And there is a brand new law, a next of kin law, California Assembly Bill 2338, that allows families to stay involved in healthcare if the person wants. So some families are very worried that when their kid gets to be 18, they will no longer be able to provide support to their child at the doctor's office or in the hospital. But this new law says that you can, and all you have to do is either your child says, yes, I would like my mother, my father, my sister, my friend to help me, and they just have to tell their doctor that they want them to make decisions for them or to help them make decisions. Or if they're not even able to do that, if they're too sick, or if they don't have the ability to communicate who they would like to help them, then the doctor can choose among the people who show up and are available and willing to provide that support, who are family members or close friends who know the person and know what their values are. The doctor can pick someone to make that decision, to make decisions for them if they're not able to make decisions for themselves. So that's a new law, and that law should reassure people that they can continue to provide support to their loved ones even after they're an adult. If you want to learn more about supported decision making for people who have communication disabilities, who don't communicate through speech, who communicate through augmentative and alternative communication, we have a whole guide about how that works in practice, and we do it. My patients are mostly patients who have very complex disabilities, who are medically fragile, so they go to the hospital a lot, and most of them do not have conservators, and it works just fine. They're mostly regional center clients who have very complicated medical problems, and most of them are not conserved by a judge. It's important to tell healthcare professionals, your doctors, what is normal for you when you're well, so that they'll recognize what's not normal for you. If you go to the doctor and you normally walk and you normally talk and you're not walking and talking, they're going to be worried you're sick. But if you always used a wheelchair and you never talked, then maybe that's normal for you and you're not sick. So if they don't know what's normal for you when you're well, when you're at your best, they're going to have a hard time knowing when you're sick. So you can, some of these resources are forms to help you fill out that say both what you look like when you're healthy, what kinds of disabilities you have, and then also what helps you in medical settings, like how do I cope with medical procedures? This is what you can do to help me if I need my blood drawn or if I need a physical exam. These are the things that will be useful. This is how I communicate. If you need to feed me, this is how to do it. This is what I need. So a form like that says, what can your doctor do to make the appointments go better, to make exams go better, to make the healthcare experience go better? They shouldn't have to guess. It's good if you've had that written down and you have it ready in your medical chart. So you've given it to your doctor ahead of time. And then you also have it in your bag. If you need to go to the hospital or the emergency room, you have it in your bag ready to go with you. There's also a form for preparing before a doctor's visit that can help you to work with your child so that they can make sure that they know, why are you going, what do you hope to get out of the visit? What questions do you have? And then information from the visit for afterwards, like, what am I supposed to do next? Do I have to go pick up medicines? Do I have to get a test done? That type of thing. So there are some forms that help write down what you want out of the appointment and then what happened at the appointment. On the website, there's also a bunch of forms to track everything from your periods to your bowel movements or poops, to your food, seizures, everything, your vital signs, what medicines you've taken and haven't taken. There are forms to track it all. And as you get older, and especially if people if you hire paid aides to help you with some of this care, it's going to be very important to create a system to write that stuff down, because you may, if your child is living outside your home, or if your child on their own as an adult, if they're using, let's say, the bathroom by themselves, and flushing the toilet, you may not know whether they've had a poop or not, and whether they're getting constipated or not. So part of transition is teaching people how to describe, how to keep track of stuff like that. And there's a bunch of forms to help them keep track, and help you keep track of what's going on with their health, so you can tell your doctor. So those are a few tips for getting ready for transition, for learning how to work with your doctor. And I'm going to turn it over now to talk a little bit more about the health insurance transitions with Dr. Nakahira from Santa Clara Health Plan.